Thomas Jefferson once opined, the cornerstone of democracy rests on the foundation of an educated electorate. Whenever the people are well informed, they can be trusted with their own government. Jefferson's vision for our democracy was premised on the notion that individuals are intelligent enough to determine the best choices for their lives, their families, and their communities, and not some monolithic, paternalistic government. A prerequisite to being well informed, however, is to ensure that the American people have adequate information about how federal policies and decisions made in Washington will or are impacting their lives. That's why this transparency is so vital to our system of government. It provides the necessary information to educate our electorate on which our democracy depends. Laws and their impacts should not be shrouded in secrecy. Congress and the administration needs to be fostering a culture of openness and transparency when legislating and making decisions here in Washington. That's what this legislation is all about, providing more transparency to the American people about their health care, specifically Medicare Advantage coverage. H.R. 2505, the Medicare Advantage Coverage Transparency Act, is a bill to do just that. Of H.R. 2505, CMS will be required to provide additional information on Medicare Advantage enrollment based on zip code, congressional district, and state. This data will be available for both Medicare Advantage prescription drug plans as well as regular Medicare Advantage. Enrollment under Parts A, Part B, enrollment under a Medicare Advantage plan under Part C, and enrollment under Part D would also be covered. The purpose of this additional data is to provide greater information to the public, policymakers, and the healthcare community so that they have the benefit of a more and better information when making decisions. CMS should provide a more transparent accounting of Medicare enrollment data to Congress, other government offices, and the American people so committees of jurisdiction can better understand how Medicare is serving the health care needs of the nation as well as individual congressional districts. H.R. 2505 would require an annual report on Medicare enrollment data so that members of Congress have more accurate information regarding the constituents' use of Medicare programs. Such transparency will allow Americans and members of Congress to better know and understand the scope of Medicare enrollment on a local level, as well as the specific populations affected. In 2014, the majority of the 54 million people on Medicare are in the traditional Medicare program, with 30% enrolled in a Medicare Advantage plan. Since 2004, the number of beneficiaries enrolled in private plans has almost tripled from 5.3 million to 15.7 million in 2014. In Pennsylvania, 18% of the total population in the Commonwealth is enrolled in some form of Medicare. Of the 18%, 39% of those folks Medicare beneficiaries are enrolled in a Medicare Advantage plan. That means that 7% of Pennsylvanians are enrolled in Medicare Advantage plans. This legislation will give me and my constituents more information about how changes to Medicare Advantage plans in Washington will impact my constituents at home in the 3rd Congressional District of Pennsylvania and every member and all their constituents around this great country. I want to thank Chairman Ryman for bringing up this bill and also want to thank Leader McCarthy for bringing this bill to the floor, and I yield back.
Gentlemen,